Neuropathy doesn't just cause discomfort, it slowly takes away the things people love to do. But what many patients don't realize is that there are modern, non-surgical options that may help restore nerve function. Hi, I'm Dr. Jay Birch with Team Healthcare Clinic. If you've been experiencing numbness, tingling, burning, or pain in your hands and feet, you might be dealing with something called neuropathy, and it can seriously affect your balance, your mobility, and your overall quality of life. In this video, I'm going to explain what neuropathy is, why it happens, and most importantly, what can be done to help you start moving forward towards relief. Do you suffer with pain or tingling or numbness in your feet? That's something you should not ignore. At Team Healthcare Clinic, we have seen patients with those problems. Oftentimes they tell us, I think it's just a part of normal aging, or doesn't everybody have that? And the answer is no. Not everybody has it, and it's not a normal part of aging. The problem that you probably have is something called neuropathy. And neuropathy is basically nerve damage. What happens with people who have neuropathy is that their nerves quit communicating properly to their brain, most often starting in their feet. And the symptoms that they have include things like burning, tingling, numbness, weakness in their feet, and a big one is balance, even sometimes when it's bad enough, falling, which is a big concern. So if that's the kinds of symptoms that you have, I want you to know, most importantly, it's not something that you should wait for. You should have that evaluated, because it's better to get to something before the nerves get further damaged. The further along they get in the damage process, the harder it is to reverse it, and sometimes it can't be reversed. When it's ignored long enough, it can show up as ulcers in your feet or wounds in your feet. It's best to get to it early. A really common thing that I hear patients say is, my socks feel like they're bunching up, and I look and they're not bunched up. That's a sign of neuropathy. And those of you that have more advanced forms where you are into those later, that's still something that should be evaluated, because neuropathy is something that should define your life. It's something that you should be addressing. My recommendation is that you get that evaluated right away. It's important to know that neuropathy has many causes, and so we usually will look at the underlying reasons that you even have neuropathy. And they can include blood sugar problems, it can be chemotherapies, it can be inflammation, it can be damage to the nerves, it can be physical causes. And because we have a team, we collaborate, we determine what the underlying reason, and then we also offer other kinds of remedies to help address the underlying reason for the cause. We don't want to be a place that just offers temporary relief. We want to be a place that offers long-term benefit, long-term mobility, and long-term freedom, so that people can have active, free lives in their future and not just in the immediate. How do you treat neuropathy in your clinic? It's a great question, because for years we didn't treat neuropathy in our clinic because we didn't think that there were successful options. We have lasers, we've used those, we've had take-home electronic devices, and they were useful. They just weren't successful enough that we really felt like we could offer that. We wanted, as a successful treatment to offer to our patients. We have now found that there are successful treatments. We use a combination of technologies. One of them, Sanexas, another is shockwave, and another fairly simple thing, but in combination together is very powerful, and that's the right nutrients. And why these are successful is that they help heal the nerves through a process of increasing circulation to the nerves. So if the blood supply to the nerves improves, then the nerve gets the nutrients and the blood flow and the oxygen that it needs, so that the nerve can start the process of healing and repairing and getting back to normal again. It's an example of somebody receiving shockwave technology for their neuropathy. And that is the second of the 1-2 punch that we use successfully to treat neuropathy. Both of those technologies, we feel like they're the two leading technologies for neuropathy, both good, but together very powerful. With any treatment, you know that this process took a long time to develop for most people. Consequently, it is a process of restoring it back to normal. Having said that, we have people that in their first 1 to 3 visits are already starting to noticing changes either in their sensations, their pain, and sometimes even their mobility in their lower extremities. And so it can happen quickly, but it is a process of getting it back to normal. But you have to start somewhere, and it starts with getting that first visit and assessment. Thanks for spending a few minutes with me today. Our goal is to continue to bring you helpful, practical information so you can make confident decisions about your health. If you found this video valuable, please take a moment to like the video and leave us a comment. We genuinely enjoy hearing from you, and it helps us continue creating content that serves you well. Be sure to follow Team Healthcare Clinic on Facebook and Instagram, and subscribe to our YouTube channel so you don't miss future videos designed to help you live healthier and stay active. And if you're looking for more personalized guidance or want to learn whether you're a candidate for our care, our team is always here to help. Just visit teamhealthcareclinic.com. We would love to see you.